I've been hearing a lot about you, Mrs. Sreenivasan Chidambaram.
I
Are
think
you a medical person?
Doctor, we are about to start. We'll chat later.
Okay.
Namaste. Good afternoon. Welcome to the COVID Recover series presented by Apollo Hospitals. This is Dr. Sreenivasan Chidambaram. And I hope that you're all staying absolutely safe, taking all those COVID precautions that we have been speaking about all these weeks. Because we are nowhere near the close of the pandemic. What with the new variants coming up and the numbers still rising slowly in some parts of the country, amidst talk of an impending third wave, it's very important to be cautious and safe at all times. The Recover series brings to you twice a week the most important and helpful information for those who have had COVID-19 to recover and regain their health and well-being. And today we have a very focused and detailed discussion on COVID recovery for our elders. Let me also specially welcome any of our senior citizens who have logged in. Namaste and thank you for joining. Many of us, I would say almost all of us, have elders at home, be it parents, grandparents, and one common worry for us is how to take care of them after COVID. Being a vulnerable group, it's important to first of all keep them as COVID safe as possible, ensuring that they're vaccinated, they maintain all the COVID safe norms, and yet take care of their physical and mental health. But despite all these measures, when they do get COVID and then they move to the recovery phase, it can be a very challenging time as the disease could have taken a heavy toll on their health. They may be quite stressed, anxious, and even have a bit of a low mood due to maybe a prolonged hospital stay. They may be fatigued. Some may need even prolonged oxygen support, and they may be breathless. They may have loss of appetite, or they might be just exhausted by being isolated all the time, and they become quite uncooperative and irritable even sometimes. And when they have other comorbid conditions like diabetes or heart disease, it just makes it more difficult to keep those in control. But when families have the right knowledge on how to take care of them at this time, how to ensure that they are well rested, nourished, active, and cheerful, elders too can make a very quick and smooth recovery from COVID-19. To tell us how to ensure elder care in the post-COVID phase, I'm delighted to welcome Dr. Jaganmani Sreekanth, Senior Consultant in Internal Medicine from the Apollo Health City, Hyderabad. Dr. Jaganmani completed his master's in internal medicine, University of Health Sciences in Andhra Pradesh, and he has been the professor of internal medicine at the Bhaskar Medical College, Hyderabad. He has been the investigator for over 15 drug trials, and his special interests are immunology, lifestyle diseases, bone marrow transplantation, and metabolic medicine. He has been a recognized speaker at various platforms, visual and print media, and he's also a trained singer and composer of Indian music and a regular performer as well. Welcome, Dr. Sreekanth, and I'm so glad that you could join us today in this COVID Recover series, and we all look forward to your insightful guidance on how elders can be cared for in the post-COVID phase. Over to you.
Namaskaram, namaste, and vanakkam to all my esteemed viewers, patients, and the Apollo Hospital staff. It's a real privilege to be on this virtual platform and try to share my experiences. I would say my experiences or our experience, because COVID is something which has hit us very badly, and we are still in the process of learning. We prefer to be student because every year it's coming out with newer things, and we are trying to explore this exploding situation. Well, things are beginning to come under control thanks to the aggressive vaccination schedule. But today's topic is mainly focused on how to tackle the elderly population, the so-called senior citizens, or the revered population, which has taken a toll, has taken a hit the entire world. Before I open this topic, there are some special features which the senior citizens have faced, or they're the most vulnerable population that way, mainly because of multiple comorbidities which coexist by then. When they reach the age of plus 60 or 65, they already have multiple comorbid factors. Waxing immunity and waning immunity is something which is of paramount importance. All these years, I think we have been focusing on non-communicable disease. And this particular COVID is something which is a combination of both. It is a pandemic, it's a communicable disease, but having a widespread manifestations, including all the systems. So waning immunity is something which has played a very, very important role in this population. If you go deeper into the subject, the waning immunity has caused a sort of a compromised situation in all the systems, giving rise to a less instances of cytokine storm. It's not that the cytokine storm is less. It's just like a shriveled tree, or it gets rattled even with the slightest possible wind. This is what has happened for almost all the senior citizens. They have been hit very badly. So from the clinical point of view, I think the first alarming sign is the fever, which usually is one of the most important earliest symptom, may not exist in the senior population or the elderly population. They may end up having a temperatures of around 99 or 100 max. The Tmax, as we call, is usually lower than the expected. And quickly, they go into a state of the so-called happy hypoxia. And this is something which is really threatening. So early recognition of these symptoms is extremely important for almost all the physicians. And thereby, early hospitalization is also a must. And once they're hospitalized, it's just not enough. We have the facility of nurses. They have to be extremely vigilant in terms of hypoxia and handling the situation. Whenever the saturations drop, you have to have the vent support or a BiPAP support or a simple oxygenator. So these things are something which are exclusively meant for the senior population. And the after effects also very much varied. Almost all the systems are affected. So you need to take the help of various other disciplines, neurology, cardiology, because they end up with various complications. We have seen cases landing with strokes, myocardial infarction, rhythm disturbances, and in fact, peripheral vascular diseases, let alone the respiratory problems like pulmonary fibrosis, pulmonary arterial hypertension, all these things, they manifest. We also had symptoms of gastroparesis, inability to digest the normal foodstuffs, and various neurological complications. As Dr. Sreekanth has already mentioned, you have various, it all happens because of the brain fogging. There is a cognitive dysfunction, and people who already have Parkinson's disease or Alzheimer's, they do suffer from worsening of these problems. So we have a tremendous inflow of such type of symptoms and signs happening in these patients. And the neurology clinics are flooded. And we do require the help of the psychiatrists also to manage the team. In short, it has to be a multidisciplinary approach. A simple virus, which is essentially a respiratory virus, has created a havoc. And in fact, I would call it a syndrome involving various manifestations and affecting various systems. So the rehabilitation process has to be as early as possible. Say, if it is 4 weeks for the initial treatment purposes, the treatment has to start off, the so-called rehabilitation has to get started right away, right from the 4th week or the 5th week. And Apollo has gone one step ahead. We have various packages specially designed for this elderly population, like COVID-Fit, COREG, and different sort of packages, which Chairman is very keen to, and he has already launched it, and we have started implementing this process. So this is, in short, I think we would be learning more and more as the questions crop up.
So, doctor, when you talked about rehab, what do we exactly mean by that? What does it really involve? And though you said it starts right away, so can you tell us a little more about that process?
Yeah, see, rehab is something which is usually done for a person who has already got affected, and there is certain a compromised situation. Certain organs or the functioning of the organs are usually compromised. There's a primary, secondary, and a tertiary. This is all put together, you call it a rehab. In these purposes, rehabilitation has to get started right away, which includes the nutrition, the exercises, because these people usually suffer from various kinds of comorbidities, plus the malnourishment. It could be a sort of an emptiness syndrome where the kids are outside, they are not allowed to come into this so-called COVID ICUs and COVID-like situations. It's something which is, you cannot describe this type of a pathetic situation. And they become lonely. Already when the people are lonely, and this adds to the problem, and that results in a so-called depression. So the first thing is giving proper nutrition is the first step. The second is rejuvenating them back, exercising, early exercise, because these people, the elderly population, have an entity known as sarcopenia. Just like osteopenia, where there is a weakening of the bones, sarcopenia is the loss of the muscle tone. The muscle mass becomes weaker and it gets reduced. And this is physiological. Anything which is around 5% weight loss is by and large because of sarcopenia in these people. And there is an exaggerated sarcopenia because of the COVID. So isometric exercises, isotonic exercises is something which is extremely important, and it has to be started from the 5th week onwards, and it has to be continued for at least 3 to 6 months. This should be under the guidance of the physiotherapist. A qualified physiotherapist team is definitely would be necessary to assist them to overcome this situation. And the third comes the various types of other medical issues. Suppose if the lungs are compromised, there are ways of rejuvenating it. If there is a setback on the heart, if there is a myocardial infarction, and post-myocardial infarction, there is an LV dysfunction, the patient is likely to go into a state of congestive cardiac failure. There are ways of building up the cardiac musculature and the tone of the cardiac muscles, myocardium. Same thing holds good for the neurological problems also. The person suffers from the stroke. There again, we have a well-equipped center known as APOCOS right now in our premises, and that's doing a great job. Again, you have a multidisciplinary team, the neurologist, the physiotherapist, the primary physician, all of us are there. And not to forget, you have people who have had fractures as well because of the falls. And we have an ortho team coming into the picture for such type of people.
Once they come home after recovering from COVID, how long should they just be, at rest, and when can they actually resume their normal daily activities?
A good question to start with. In the sense, if people have no comorbid factors, it's only the age if it is contributing, then it becomes easy. And more so, if the people have a right attitude, the positive attitude to overcome this problem, then again it becomes easy. The difficulty comes for people who have comorbidities, who have no assistance at home, and these are the people who have got to be looked into. And for such type of people also, I think we have a good supportive system in the form of Apollo Home Care, which again, it was the brainchild of our managing director, Mrs. Sangeeta. So again, we have the multidisciplinary team coming up. And usually it takes about 4 to 6 weeks, but there are people known as a long haul COVID. This is a term which is recently coined. It's known as long-term effects after 6 weeks. Sometimes these persist, and there are at least 20% of them coming up with various very common symptoms like fatigue, undue fatigue, then dyspnea, then de novo detection of diabetes. People who are not diabetics, they become diabetics thanks to the hormonal imbalance and then administration of steroids. And hypertension is one thing which has been noticed. Dyslipidemia, abnormal levels or increases in the cholesterol levels. All these things have been observed amongst this population. And these are the things which have got to be dealt with. Apart from the so-called the psychological symptoms like depression, anxiety, sleeplessness, insomnia, they are all the common symptoms which these people experience.
So what we were talking about the exercises, and you were talking about the isotonic and isometric exercises. After the physiotherapy part of it is over, what kind of exercises can the elderly resume? If I suppose like walking or
simple walking to start with. If they don't have any neurological deficits or orthopedic problems, simple walking, initially with assistance and later on their own, should be enough. And at the end of 1 month, if they are able to achieve at least 2 to 3 kilometers in 1 hour, I think they are on their way to recovery. But the thing has to be gradual, in a stepwise way. You cannot ask the person to go back to his original schedule. Yes.
The next thing is about the nutrition, because as it is, as you said, they may not be very well nourished, and then with the COVID, the loss of taste or smell or appetite or whatever, they are not, many of them complain that they are not able to eat, they're not hungry. So what kind of a nutritional support should the family give such ailing elderly people who don't feel like eating?
Yeah. See, again, it is personalized, I would say. As an internal medicine person, I keep coming across diabetics, hypertensives, and people who are dyslipidemic. All these things may already exist in at least 50% of them, the population which we have mentioned. So accordingly, the diet has to be personalized. But in general, I think if there is no problem or involvement of the kidneys, increasing the amount of protein should really help in bringing back the immunity. Number two, the muscle tone. The sarcopenic state which exists can be overcome by slightly modifying the intake of protein. Instead of giving 1 gram per kg, we are going to give it 1.5 grams per kg body weight. So that, I think, probably would be guided by the dietitians. We have a diet chart given to them, and then we are going to see that they're going to follow that.
Do people who already have certain comorbid conditions, do they have to take any extra precautions, as in the post-COVID phase, apart from the usual exhaustion and the long COVID symptoms, are there any signs and symptoms that they should be particularly aware of in the recovery phase?
Correct. So here, I think the first thing from the medical point of view, what we advise is COVID as such stimulates or promotes the coagulation process, a thrombotic tendency. So the blood is liable to clot. And this is the very reason the platelets and there is a sort of an increased aggregation happening at the microvasculature. So this would result in strokes, though not at that particular period, but even later. So this can be so-called assessed by a simple test known as a D-dimers, which we keep checking regularly. People with high levels of D-dimers or having these sort of a comorbid factors, we try to use platelet inhibitors like aspirin or clopidogrel. Or in the first phase, we try to use factor 10A inhibitors like apixaban and rivaroxaban, at least depending upon the condition, because we have seen cases with frank pulmonary emboli and peripheral vascular diseases secondary to emboli. So these things prompt us to use oral anticoagulants, the newer oral kind anticoagulants, for at least 3 to 6 months. This is the first step. And other than that, it is the antioxidants which play a very, very important role. It can be anything, usually A, C, D, E vitamins are given on a regular basis for at least 6 months from the day. These are the usual so-called prescriptions which accompany the routine medications.
A lot of the elderly also need oxygen, and when they come home, also they are pretty breathless, or they feel that something is, it feels a little spasmodic. So, what is your advice for such people, and are there any precautions that they should take?
See, normally a person gets hospitalized as per the raised guidelines if the saturations are dropping to around 93. These are as per the guidelines released recently. And once he gets stabilized, either in the hospital or he comes out of the ICU after the ventilator support, if in case if it is necessary, his saturations normally we make sure that they are hovering around 95. And if the person does require an assisted support like home oxygenator or a BiPAP machine, we advise the patient accordingly. See that the saturations are maintained around 95, 96. So such type of people probably may require either as an oxygenator or a BiPAP machine support for at least 1 to 2 months before they're stabilized. It all depends upon the extent of the lung damage which a person has undergone. Such type of people probably may require this support, the so-called accessories, for at least 1 to 2 months.
And what about those who have been on ventilation and it has been removed, obviously, before they come back home? Are they likely to have some issues with swallowing or with eating or drinking, voice changes? So what can they do for that?
Yeah, it's a very common and good question from the patient's point of view. Ventilator is something which usually is given for a max of 1 week. If it is more than that, or if the patient requires a vent support more than that, we try to slit open this windpipe from this end, known as tracheostomy, because extended ventilation always creates a sort of a damage to the oral mucosa and the oral cavity. So it also causes a clogging of the various types of tubes. You have the feeding tube, you have the respiratory passage, all these things, they try to clog this. So it makes the weaning process difficult. So it's always better. 80% of them probably we try to switch the ventilator in case if they need it for an extended period of time by doing a tracheostomy. But yes, all these people, they do suffer from a sort of change of voice for quite some time, but it is reversible. They do get back with good bit of so-called respiratory exercises and speech therapy over few sessions. It is essentially reversible. So I am not skeptical or cynical. I don't say that patients are not going to recover. It's a temporary phase.
Before we go on to the questions from our viewers, I just wanted to ask you about the whole psychosocial, psychological changes, and which is an important part of the healing process as well. So what would you advise to the caregivers, to the family, with an elderly person who is recovering, but who is obviously not, like quite depressed or maybe irritable or not always in a kind of a low mood? So what practical advice can you give families on how to deal with this and help them recover?
See, again, it involves a lot of counseling, not only to the patient, but also to the patient attendants. The patient attendants have got to fully understand the nature of the disease and take enough precautions. See, it's something which the first thing is they try to shun. The moment they hear that the person has got COVID, the first reaction is denial from the part of the patient and dismay and not so-called non-acceptance from the attendant point of view. They try to go away because they might be affected. So all these things can be overcome or circumvented with the so-called universal precautions. Maintaining the social distancing, then wearing the mask, sanitizer, and of course, you have the vaccination now. These 4 things are going to help, at least in assuring the confidence from the patient's point of view as well as from the attendants. So you get started that way and then try to spend time with them every day, at least twice. Spend some time. If they like some sort of relaxation or recreation, few people are back to books, then few people are back to their writing skills. And of course, being a musician, we have a so-called, I suggested to have music therapy incorporated, which is again personalized. So depending upon their choice, they can tune to the music of their choice. And that elevates the mood. And naturally, you have the endorphins playing a vital role in such type of situations, and they can overcome. Spending the time is something which is extremely important for these people, and imposing the confidence goes a long way.
We'll now go to some of the questions, which I will read out. The first one is this. My grandfather, aged 81, got mild COVID symptoms after taking the first shot of the vaccine. For how long do I need to wait for the second shot, as now he has recovered completely?
When was the period over completed? Is COVID?
It doesn't mention that.
Okay. Usually it is 60 to 90 days. Once he has been detected to be or tested positive for COVID, after the completion of the course of treatment, it is usually 90 days because you have acquired the so-called immunity against the COVID in a natural process, because infection triggers off the antibody response, and that would be there or circulating in the body for at least 3 to 6 months. Say, assuming, because he's a senior citizen, I would say that 3 months would be the most ideal situation where he can have the second shot. That would act as a booster.
This question is not very clear, but I'll read it anyway. I had done my leg operation, but I have swelling and bleeding, staining the cloth. But I can't go to the doctor as I'm suffering from COVID. What can I do?
A very tricky one, but suffering from COVID from the last how many days?
Well, I'm afraid we don't.
See, it's not a contraindication. If see, bleeding is something which is a medical emergency. If the bleeding is minor in the form of some spotting, then you can afford to plug it by a compression, any sort of a compression. But if the bleeding continues or becomes heavy, then it becomes a medical emergency. Then COVID is not the entity, because we have the facilities and we do take care of such type of people. So don't hesitate.
Best that they seek the medical help.
Yeah.
Why are older adults and those with chronic health conditions at higher risk of getting post-COVID infections after recovery?
Yeah, this I think we have answered at the outset itself. It's the waning immunity. See, the elderly people, the immunity starts dropping. It's just like the kids where the immunity is immature. Here, the immunity is waning off. It is just like going down. So such type of people are more vulnerable for not only infections, but various other factors also. This contributes to the quicker onset of infection, and this forms the basis for the so-called adult vaccination program, which I think we have started off around 5 to 6 years ago. In fact, I had to speak to beloved chairman and impress upon him, because this is something which is definitely going to be necessary for the future population of India.
After how many days after recovering from COVID-19 can an elderly patient get black fungus? Is black fungus life-threatening for them?
Yeah. See, black fungus is something which I think media has definitely created the hype. And it's not that uncommon. We did come across cases. By and large, it is the overuse, and sometimes I would say that it is a misuse of the steroids, which has resulted in this form. Black fungus definitely is a sort of a medico-surgical emergency, depending upon the condition of an involvement. If it is just localized to the sinuses, then I think probably we can go ahead and then do an debridement with antifungal assistance. But definitely, yes, it has to be tackled after hospitalization.
Do the post-COVID recovery symptoms differ in older adults as compared to the general population?
Definitely. Definitely, yes. Because younger population, or the so-called our Indian population, is around 30 to 30% between 25 to 60. And after 60, the population again is going down. So the symptoms and other comorbidity factors are totally different. We may not have all these factors in the younger population, but the senior citizens definitely already have several comorbidities, and accordingly, the symptoms or signs, plus the psychological factors, many of them probably in the changing social fabric, you have people staying alone, or the so-called emptiness syndrome prevailing upon. So definitely the factors are different. The psychosocial factors, the medical factors entirely are different. So the tackling also is again different, would be different.
How should my grandmother manage her need for routine medical care in her chronic conditions after she has recovered from the COVID?
Just like any other person. But Again, periodic reviews are necessary. Make sure to see your primary physician, whoever she's attending on to. And these things, the things which I have mentioned regarding aspirin or clopidogrel, the usage of oral anticoagulants, all these things have got to be looked into. And the person should be reviewed periodically, at least initially for the first 1 month, and then later on every 3 months.
What is a good level of antibody for elderly people post-recovery from COVID?
See, this is again totally, it's a variable entity. If you go deeper into immunology, which is my specialty, antibody titers reflect very poorly. They don't actually mean anything. So people are in a tearing hurry. They check the antibodies. They make sure, oh, I have antibodies. And few people are disappointed by seeing that the whole thing can be explained by what's known as, we do have some memory cells. And memory cells, they do not circulate in the bloodstream. The moment the virus strikes again, the memory cells release. So at that point of time, you need to check it. But the circulating antibodies, they do not reflect. They are very poor indicators.
So we can take it that after 14 days that the person should be considered as recovered or not infective anymore?
If it is the acute condition. Yeah.
Rather than do the antibodies and
correct. Yeah.
There's also this practice of people, they don't do the RT-PCR, of course, after the 14 days, but they do the IgG, and if that is there, then they conclude that the active infectivity is not there. Is that right, doctor?
Again, this is something which is a very controversial subject. Even the dead virus is supposed to show positive things in the RT-PCR. So this is probably the reason that the guidelines have been issued very clearly. They have stated it's not necessary to repeat the RT-PCR at the end of 14 days. It's by and large based on the clinical outcomes and having a comprehensive approach regarding the rest of the lab data. Like you check the serum ferritins, interleukin-6, CRPs, make sure that the inflammatory markers are getting lowered. When it comes to antibody titers, there are no guidelines as per the latest versions. It's just that goes by the clinical parameters and the rest of the lab data.
How long should an elderly person take blood thinners after the COVID recovery?
You mean to say the elderly population or the normal person? Elderly population, yeah. Elderly populations, normally I would advise first 1 to 2 months or 3 months, it will be the newer oral anticoagulants like epixaban or rivaroxaban. If the person is absolutely stable, very mild COVID, then either aspirin or clopidogrel would be necessary. I would say because they have multiple comorbid factors, most of them, I would advocate the use of either clopidogrel or aspirin for life.
I suffered with COVID-19 infection on March 21st and recovered by oxygen support in 4 days at the hospital. But now I'm having very minor issues like headaches, gastritis, little cough. Now what should I do to get free from that? And also, can I travel by flight?
What's his age like? Again, you are talking to a senior person, senior citizen?
That I wouldn't be able to say.
Anyway, let's think that or imagine that he's a senior citizen.
Yes.
I don't find any reason for him not to travel. His headache or so-called tiredness are, as I have mentioned earlier, are one of the common so-called post-COVID sequelae, which normally he would get over it in course of time. Maybe I think let him review his blood pressures and other factors. And if these things are normal, a small dose of antidepressants or these things should suffice in helping him around.
Is a fully vaccinated senior citizen protected from COVID in the third wave? What precautions need to be taken?
No. See, again, giving 2 shots of so-called either Covishield or Covaxin or whatever vaccination which is available or which he has taken doesn't offer 100% protection, but it definitely would reduce the severity of the infection even if it strikes. It is just like, it behaves like any other flu. Well, we had a couple of cases which we have lost even after taking 2 shots, but the reasons were different. In the sense, we had multiple other comorbid factors which have played havoc. But majority of them, the infection is far, I think it's very, very mild. But it doesn't offer 100% protection. 100% protection is offered by only following the so-called safety protocols and stringently for adhering to these norms.
This is the last question. After recovering from COVID 6 months ago, my 65-year-old uncle can't taste things as it used to be. Is that still normal after 6 months?
Usually, loss of taste and smell is one of the most important early symptoms of COVID, which most of them experience it because of the neural blockade of the virus, and it is reversible. If it is stretching for more than 6 weeks, say in your case it's around 6 months, probably, yeah. So the other factors also have got to be looked into. And quite often it is the acid reflux in this age group, having hiatus hernia or an gastroesophageal reflux, which may alter the taste to a larger extent. So these people get benefited by the use of either H2 blockers or PPIs like omeprazole or pantoprazole and these type of things. But it's always better to have an endoscopic study to make sure that these things are ruled out.
Right. So thank you, Dr. Sreekanth, for patiently explaining and answering so many questions. I'm sure that our viewers found a lot of benefit from it. Thank you, viewers, for joining in today. And I do hope that you all found this session informative and interesting. See you at the same time, that is 2 o'clock next Tuesday, the 13th of July. We're going to talk about bone and joint symptoms post-COVID infection, and this is going to be discussed by Dr. KJ Reddy. Please subscribe to our YouTube channel as well to get the latest information and updates. And of course, if you have any further questions, you can always put it on our Facebook page or inbox of our FB Messenger, and we'll be happy to get back to you. Meanwhile, till we meet again, take care, be safe, and don't forget both the SMS, which we used to talk about, which is the social distancing, the mask, and sanitizing, but also the 5 Ws of COVID-19. So all these precautions, you know what is the first W, which means that you have to take all these precautions that I just said. When, every time, where, everywhere, who, everyone, and why, so that we can stay protected and keep our loved ones also protected from COVID-19. Namaste, and thank you very much.
Namaste.